Hello, welcome to Knowledge on the Go, the podcast brought to you by the Vizient Performance Improvement Collaboratives team, and I'm Marilyn Sherrill, Knowledge Transfer Director. Managing chronic COPD patients is difficult under the best of circumstances. Add social determinants of health to the equation, and managing patients becomes a challenge for any facility. Curt Muhammad is the case manager for COPD patients at Harborview Medical Center, a 413-bed hospital and the only Level 1 trauma center in King County, Washington. Curt has an everyday, up-close look at barriers chronic patients face. To generate better results for those patients, Curt and the Harborview Medical Center leadership needed to establish a respiratory protocol that included training for social determinants of health. One factor stood out that would determine the success of that protocol.
We recognized early on that staff training was going to be a critical component to ensuring that our protocol was consistent and effective in meeting the needs of our really diverse and complex patient population. We recognized that we needed to support our staff in developing their competency and confidence in working in those areas with our clients. We broke down our staff training into two areas. One focused on new staff training, and then the second area was a ongoing refresher training that we offered to the entire staff that was intended to make that relevant and interesting according to basic adult learning philosophy and strategies.
Heavy workloads and anxiety from the staff about new learning were obstacles to address.
Normal workloads have always been a challenge in a hospital the size of Harborview. Just getting the staff to refocus or to begin to broaden their focus on chronic disease was a challenge. And so we had to show a willingness to support the staff in managing these increased demands that were being placed on them. Initially, there were a lot of questions, a lot of anxiety with new learning. So we made sure that we presented the information in a format where feedback and questions were welcomed, and we sought to really emphasize the benefits our staff would receive by taking on these new learning modules.
Curt knew Harborview had to craft a plan to alleviate staff concerns and create excitement for the training.
We first established really clear program goals and policies and procedures. We met with our staff to ensure that everyone understood what the expectations were, and we were really sincere in seeking out staff feedback on what they felt the protocol or the policies were lacking. Once we got our staff input, we made changes to some of our protocols and our scoring tools. And we just combined that with a staff assessment. This was all focused on providing a personalized experience for our patients.
Harborview's chronic COPD patients needed that personalized experience because of the severity of their everyday living conditions.
We shared with our staff that 15% of our COPD admits have substance use disorder, whereas 23% of our readmissions have a substance use disorder, as well as 15% of our COPD admits are experiencing homelessness, where 23% of our readmissions are homeless. Additionally, we saw that our Native American population is only 2% of our COPD admits, but they made up 29% of our readmissions. We needed to understand and factor in these social determinants of health in how we supported our clients in their health. All of this was focused and delivered in the context of treating every patient with dignity and respect, and with a patient-centered emphasis that took into account the cultural and socioeconomic factors.
Their patients saw positive benefits immediately.
Our patients really appreciated the new energy and excitement that our staff brought to the bedside, helping with making sure they're on the right medications. We saw an immediate improvement in self-management skills. We saw our patients really excited about giving feedback on the new engagement and greater concern that our staff were showing them.
The new protocol and staff education also helped Harborview patients in ways no one could anticipate.
We are beginning to see a growing confidence in our patients that they are now more receptive to some of the other health-related advice that our staff are giving them around smoking cessation and some of their other comorbidities.
One patient's story particularly touched the staff.
We had a client that was frequently using our emergency department resources. She had a history of COPD. She was also struggling with an alcohol use disorder, and she was homeless. She was coming into our emergency department quite frequently, usually for COPD exacerbation, but she was typically also experiencing some level of alcohol intoxication. Well, we were able to utilize our protocol with the staff training we did around cultural competency and engage her in the emergency department around her inhaler technique. She was so impressed with the idea that respiratory therapists were coming to meet her in the emergency department and were concerned enough to talk to her about her inhalers. She was beyond excited that someone like myself as a case manager could then follow up and help her around some of the other challenges she was experiencing. She grew in confidence to allow us to work with her to help find housing and to get her in an alcohol detox program, and has been doing quite well ever since.
The respiratory protocol provides other positive results.
There was an immediate impact on our COPD admissions, our COPD readmissions, our patients' length of stay, and our hospital rapid response. There was a trend in all of those areas that we were really happy to see, which we believe was responsible for a $160,000 cost avoidance within the first 6 months of implementing the training that we have developed around our protocol. We also have seen consistent declines in our COPD admissions for the last 4 years that we've used our protocol with ongoing staff training. In collaboration with the Vizient Collaborative, we were able to have an impact with increasing our chest clinic referrals. They've gone from 60% up to 80% as we've expanded our staff training into the importance of having follow-up appointments for specialty clinics. We've also expanded staff training around the importance of pulmonary function testing, and we have seen our referrals to our pulmonary function lab go from 50% to 75% within the last 6 months.
Harborview leadership also gained valuable insight from this initiative.
You have to continue to listen to your staff and what their concerns are and help them to balance the moral distress that comes with being placed in an environment that is so volatile and so unpredictable, and yet try to maintain skills that are intended to support patients that have these chronic diseases.
The staff also learned a valuable lesson.
Staff are going to develop their priorities around what they see hospital leadership focused on. It is critical that leadership continue to communicate to staff the importance of staff being focused on value-based care as well.
And the patients taught everyone a bigger lesson.
Our clients are the experts in what they want. They're the pilots that are flying the plane of their life, and they're going to land that plane wherever they decide to land it. We need to just be able to either help guide them to a safe landing or accept the fact that we may not be the best person to influence where that particular plane is going to land. I use that metaphor quite a lot in thinking about how we can best support our patients and maybe have a healthier perspective on what role we play in our evolving healthcare system. That has a really important impact on the staff and their feelings that they're making a difference in the lives of the people we take care of.
Thanks to Curt Muhammad from the University of Washington Harborview Medical Center for sharing their story, and to you for listening to our podcast. We'd love to hear from you. Drop us a line at knowledgetransfer@vizientinc.com. From the PI Collaborative team, I'm Marilyn Sherrill. Remember, knowledge is transformational. Share it.